I thought I pressed to record again, but maybe I didn't, so I'm starting over. Okay, so here's the screen after you just log in. You come down here and you just click this icon, and that starts the program. For some reason it's asking for a PIN number just to make changes to the computer. The PIN number is 1959. You should only have to do that once, and then it shouldn't do that, ask you anymore. And so once it does that, it loads up software, and you can choose your name here from the list. I already have it highlighted on my name, so I'm going to click OK. Then it gives you this option, and usually you just choose Show Patient History. And it gives you the list of people that have had their picture taken today. I took my self-picture today, that's why I'm on here. If you wanted a different day, you would go up here to Change, go down here to Filter by Session Date, and you could do yesterday or last week or last month or any day, and then just type in somebody's name, last name, and come up with everybody. But usually it's just simple, it's just to leave it on today, so that only the people that had their picture taken today will pop up there. For some reason, sometimes it'll do the today and yesterday when you choose today, but that would be fine too. So now you just click on my name and click OK. And it'll load all the pictures from the past. The most recent are always on the top. I've taken a lot of pictures of my own eyes, so that's why there's so many pictures here. You just click on the top right one and the top left one, and then you click Open in Link Window. And then both pictures will show up. So this is the inside of my right eye, and this is the inside of my left eye. I usually will click on this Optimize button. It just kind of makes the picture a little bit brighter and a little bit easier to see. And when am reviewing them, I usually have the lights down just so it's easier for the patient to see their own pictures. So the way the software works is if you have your cursor on this side and just scroll your mouse, it'll zoom in like this. Now, if you're on this side and zoom out, it'll only zoom this picture. But once you click this picture, now it'll link the two of them. So whichever picture you're on, if you just click your button, it'll link the two pictures together. But if you switch and don't click, it'll just do one. But now if I click, it'll link them again. And so again, to zoom in and out, you just use the little roller on the mouse. And so what I usually do is I first zoom in and get centered on the optic nerve a little bit. If you click your mouse button and just drag it, it'll move the pictures to be like this. So usually I will start off by telling patients that this is their optic nerve. The optic nerve takes the signal out of your eye to your brain so you can see. And I will usually mention that glaucoma is the main disease of the optic nerve, as well as sometimes increased cranial pressure. I just like them to know we're checking for more than just one thing, I guess. So I usually say like those couple things. And if I say their optic nerve looks good, then I slide over and I say this dark area is your central vision, the macula, and this is where we check for macular degeneration, and this also looks good. And then I slide back over, and then I say these are the blood vessels, and I come up here and click on this button, the green separation view, and this is where we especially check for diabetic retinopathy. And so I kind of click and drag and work my way through their blood vessels. And obviously I'm doing this a lot quicker in the exam than I am right now. It usually only takes maybe 90 seconds to review the images with the patient. And I tell them I'm looking for blockages or clots or bleeding or leaking or high blood pressure or diabetes effects of their blood vessels. If it all looks good, I go back to where I started from. And then I click back on this button to go back to the regular view. And then I'll zoom out. And I'll say that out here I'm checking for retinal detachments, retinal tears, or tumors. If there is anything of note, I just kind of point it out to them that, oh, I have just a little bit of excess pigment here, just a little thin spot of my retina here, and you know, we might say that now we have a record of those, so if we take a picture every time, we can just make sure none of that changes. You know, obviously do whatever you want as far as explaining the symptoms of retinal detachments or tears, those kinds of things. Then I come back up to here and go to this icon for the red separation view, and I say here we're looking behind the retina, and then I point out maybe a little freckle that we again can monitor every year, a little pigment showing that's probably been there for a long time, a couple little pigment spots over here that we can monitor, and then we go back to here. And lastly, and this is what patients usually really like, is this little icon here. If you click it and then maximize it, this is an animated view showing the inside of their eye. And so that they can have a better perspective of that. Over here, if I will zoom in, you can choose between full view, transparent, or retina only. I like transparent because this way it still shows their iris, and you just kind of, then you can click and hold your mouse and move it back and forth, and just to help them get a better idea of how much of the inside of their eye we were able to capture and help them understand it better that way. So again, it doesn't usually take this long, but those are the steps I usually go through when I'm showing them their optomap. When you're done, you just have to come up here, and you don't X out the whole program, you just X out this. That will close the animated view. Then you push it again, and this window pops up, and if you just X this out again, then you have to come back up here and exit again for the other eye. Again, you don't want to do the whole program, because if you do the whole program, then you'll have to start it every time. And so you don't want to hit that button until you're all done for the day, basically, because you just want to leave the program up. And then when you want to go back to see your next patient, you come up here to this window and click on this little person's face, and that brings back up to who has been taking pictures of for the day, so that you can choose from another patient. And to close these pictures out, you just X this out one more time. Oops, I missed. I gotta close this first. Okay, so you close this out, and that way it's just a blank screen, so you don't have somebody else's retina up all the time. And then when you're ready for your next patient, you go back to this little icon and click on that person's face to pick your next patient. Hopefully that makes sense. After you guys watch this video, like I said, the staff's going to have a training on Thursday, so they'll be ready to take pictures. And let me know if you guys are comfortable to have them start taking pictures for your patients. If you